Hello and welcome to NewsClick. We are today going to be discussing the spread of the coronavirus in India, which is now being called an epidemic in this country, but is actually a global pandemic. And to talk to us more about this, we have with us Mr. V.R. Raman, who's part of the Delhi Science Forum and also is the national convener of the Public Health Resource Network. So, Mr. Raman, if you could explain to us right now, what is the general situation? Because there are so many updates that are coming with the spread of the COVID-19. So, if you could tell us a little bit more about the current situation.
If you see the global share of the pandemic, still China is contributing the major share of it. So at this point, close to 80,000 cases and a large number of deaths are recorded in China, followed by some European countries, Iran and all that. So broadly we have 1,14,000 cases, confirmed cases globally, and around 4,000 deaths confirmed by WHO by as of yesterday, I mean 10th of March. So currently this is spread in 109 countries. So the spread is, it is quite big and it is growing. So that is a concern. While the mortality is within a 3% rate, the problem is with the health systems. The hospitals are overcrowded. Panic is on across the globe. There is no medicine or there is no treatment available. So globally it is becoming a major issue, and travel and economy, a lot of slowdowns happening as part of this. And so globally the situation is quite alarming at this point, and WHO and other organizations are putting a lot of efforts. Country health systems are into it. So coming to India's situation, the government till yesterday they have reported 50 cases. But today morning, as of now, the total number of cases, including the 3 cases that has been cured in Kerala, it looks like we have 62 cases, confirmed cases as of now, wherein 59 cases are live and getting treated. No deaths in India, but currently we have crossed a stage of disease caused by international travelers to a locally transmitted situation. So WHO yesterday has classified India within the locally transmitted situation. So that creates a lot of challenges for India.
Actually, that brings me to the question of the kind of challenges it creates for India. In terms of the kind of panic that this has created, there are lots of messages that circulate on WhatsApp. There are a lot of advisories that are being issued. Now, is India prepared to handle the kind of spread this epidemic has, just to handle the spread of the virus? And the second stage of my question is it even ready to handle cases that are coming into hospitals with the infection of this virus?
The panic is quite high. And some of the private companies, their staff, have been found positive in Delhi. And second company, as I understand today, one more company has been closed today. Again, in suspicion. So that is one set of panic wherein people are worried about the spread of the case. The second thing is the information panic. The information panic is the most dangerous one as far as I understand. Rather than going by scientifically reliable kind of information, there are many organizations and outfits which are spreading sometimes even mischievous kind of information and guidance to the people. And with a large number of people believing, and some of the people who are making these kind of statements are supposed to be responsible, but they are not acting as responsible. Like some politicians or some community leaders or some religious leaders, wherein they are suggesting that cow dung or urine or those kinds of things can be used for, and alternative systems of medicine also are claiming that they can cure the or address the virus situation, wherein this has not been scientifically proved. The awareness on this is yet to be improved. So overall, the situation about information, we need to really go by what the World Health Organization or the government sites are formally giving. At this point, it is very important, extremely important, that people are focusing more on hand hygiene. Very frequent hand washing in a very careful manner, that we are not causing the virus getting into our hand and through our hand it is going to our face, eyes, nose, and mouth. That is something very important that people have to take first. Second, people have to keep some safe distance when talking to people with some symptoms, or in public places even without symptoms, since you don't know. So that safe distance, that makes a lot of importance. Avoiding crowded places, festivals, religious gatherings, and various other forms of coming together.
It also makes one think that how will this affect the daily lives of people? Because we have read messages that have come even from our relatives who are staying in US. Many of them have been given work from home. In countries that are directly affected, they've become ghost towns. In China, I mean, you have ghost towns. How will India tackle this?
So one of the things is that work from home for officers. So Kerala government has done yesterday some very interesting measures they have taken. So one of the important measures is that they have closed all the schools till 7th standard. Only exams will happen in the school. So that kind of a gathering and morning movement of the students they have. And they have also looked at, interestingly, the Anganwadis, when it gets closed, so the food are taken to home, prepare food and get it to the children at home. So those kinds of measures. And interestingly, one other thing which is notable here is that the Kerala Chief Minister's press conference yesterday underlined that because people are going to sit at home for a longer time, they are also considering improving the bandwidth for internet usage. So that's a next generation kind of thinking. Yeah. So there are a lot of things that we need to do at this point. We need to think about how from an office situation, when people are working from home, how connectivity and other things are improved, and the virtual kind of ways, what all software, what all kind of things needs to be given to them. All those things will come into consideration. And the other thing is that how to control gatherings. Quite often I was seeing, again, a Kerala example. Day before yesterday, there was a mass gathering in Kerala, in Trivandrum, which is called the Atukal Pongala. So this gathering, if because it is religious and there is a lot of sensitivities around, so the government probably didn't find it
reasonable
to stop it.
Yeah.
But it was important for those kinds of gatherings to be stopped. So now, at least from now on, Holi, there was some messages coming from, but still yesterday I was seeing across Delhi or other places, the gatherings of Holi, although it was reduced compared to previous years, but it was there, gatherings were there, and people were, coming together, playing and all that. So these kinds of things, people have to understand now that unless and until we are moving away from this kind of a situation and taking more precautions as a society, the government alone cannot tackle this problem. Government and people together only can tackle this problem.
Actually, it makes me think of another part, which I get a lot of all of us would be interested in. Has India been able to handle any other epidemic of a nature that is close to the coronavirus epidemic?
See, the Indian health systems, it is one of the fragile health systems across the world. So it's a mix of private, public, recognized, non-recognized. It's a huge array of practitioners who is providing healthcare to people. And our preventive health systems are exceptionally poor. We are very good for conducting some vaccinations and reaching to people for some immunization programs and all that. But beyond that, if you look at our ability to do the vigilance, do the surveillance, and to reach the large set of population. And one of our major challenges that the population density, population, all that needs to be considered. Within that, our ability, our preventive systems ability is very limited. So these are something to be understood while we are talking about our health system. So, but there are some examples. But in any case, Kerala seems to be an outlier in the Indian situation, wherein last year and even before, one year before last year, there was an episode of Nipah, which Kerala, in a very planned way, in a very efficient way, Kerala could control the spread of the virus, and the health systems were quite equipped. Trainings were given to all kind of actors. People were taken on board for acting as educators and supporters of the health system. So the Nipah case really gives us hope, but the problem is that out of Kerala, the Indian health systems are extremely different. So while we have a Kerala case study, I don't think that is giving much hope for health systems outside Kerala. Tamil Nadu is also, to some extent, their preventive health systems are well spread. Maybe Karnataka can do little more, and with Panchayat health systems, maybe West Bengal is having little more reach to the people, but many other states, the larger ones, are really under threat. So,
Uttar Pradesh,
Madhya Pradesh, Rajasthan,
Kashmir,
Chhattisgarh, Kashmir,
yeah.
all those health systems need. In Chhattisgarh also,
Mizoram,
because of the community health workers, there are some reach, but not necessarily how the government plans their outreach and how they are well trained and equipped for this kind of situation. Currently, it's an urban threat. We need to understand the COVID-19, the coronavirus, is currently limited into urban kind of spheres. But the more we are traveling, because now it is a local transmission has started. Yesterday's ministry notification still says that we are only limiting to international travelers. That protocol needs to be changed now because we have local transmission and it can be even more. So once it is for example, I can tell you most of the Delhi people over the last couple of weeks, Delhi had some specific infections and we don't know whether people have interacted with infected people or not. So possibly there are silent carriers around. And that's a threat. And this threat, how much we have realized this threat is something we are not aware. And if you have noticed, last week during Holi and around even now, many people are going to Himachal Pradesh villages as tourists. So how responsible these tourists are, and how responsibly they are, having an awareness about we could be, we can be the potential carriers for this kind of a situation. And how much are we taking these problems to the rural areas? That kind of thinking, I think, is missing.
It's in a country like India, it's also pretty difficult to enforce or to get going in terms of smaller groups that will be going to the ground to create awareness.
This is what
It's a huge challenge.
It's a huge challenge. This is what we need to learn from Kerala. Although it is difficult to learn from because of the fragile systems outside, but it is important still to say see how they are handling it. So each and every traveler who is getting down in one of the airport or whatever, or even in the Nipah cases, they were able to trace it to all the various contacts, and they may prepare a map, full mapping of where all did they go. And then based on that, all those people are either requested to contact the health system or reached out by the health system to understand whether they are in a potential threat or not, and then they are put into isolation and observation. So it's a lot of care, lot of precautions that the health systems has to now initiate. Then only you can handle. The other problem is with while the upper class and upper middle class and economically better off people are very well aware about the situation, the poor class and the working class in urban areas are going to be affected. So what are we thinking about, and how are we going to tackle this problem in slums, in areas where the working class is living, and how are we taking them on board? Because many of them are thinking this is not, one, the message is not properly reaching them. Second, they are thinking that this is a problem that they may not be easily getting. So there's a lot of, and also lot of superstitions and the wrong messages are going to them through WhatsApp, like some temperatures, lot of wrong messages are going. So it is a very difficult task to reach out to the working class and urban poor and take them on board in terms of information, and then providing them services.
So a lot of cooperation from both the center and the state health departments have to come on board in every which way, because health related services is very expensive in India.
The thing is that now the cases are under control. We don't know. The government of India is yet not putting out how many people are under observation, how many people are precautionary kind of admissions are given to how many people. This kind of data, except in the case of Kerala, we don't have that kind of data. At least I'm not able to trace it. If at all government has put up it in NCDC or somewhere, I'm not able to trace it. But currently, we can assume that if 62 cases are confirmed, so it could be some 10 times of that people will be under observation or even more. But since it is a local transmission, this can go up. Once this is going up, currently the hospitalization requirement is around 20% of the overall positive cases. Not all cases require hospitalized attention, but this 20%, the more cases are going up, the more hospitalization requirement also will go up. And our hospitals are not really equipped. Specifically in the central state cooperation kind of thing that you said, it is very true for Delhi kind of a state, wherein part of the things are with the state government, part of them are with the municipal corporations, and part of them are with the central government. Yeah. So this triangulation, how they are going to do it, is important for a city like or a state like Delhi. So how they are doing it, at least there was a meeting yesterday with all these people, the Chief Minister of Delhi, municipal corporation people, and the Health Ministry. There was some discussion happening, and how this is taken into an action plan and then implementing is going to be quite vital. Then equipping the Mohalla clinic kind of situation in Delhi, or the primary health care centers in the urban areas of other places.
Or semi-urban areas as well, in rural.
Precisely. So these, how the governments are equipping them and how the governments are training these people, because currently we have something called the IDSP, Disease Surveillance Program, which is limited to, the reach is limited up to a block level or a district headquarter. In many cases it is only up to district headquarter. So now the surveillance needs to reach to even household level and habitation level. So how would you ensure that the frontline workers onwards, all the various health system actors are involved, trained, and they are, so this kind of a preparation is needed, and this battle is long. This battle is not, as far as we understand, the corona virus need a lot of persistent, will require a lot of persistent effort. It is not one time kind of a thing, and that is what one of the error that happened in Kerala was, they successfully handled 3 cases, and the people were discharged from the hospital, and they were thinking that now the things are over, our challenges are over. All in a sudden, within minutes, one family violated the principles in the airport, and they met various people, and now close to 1,300 people are under observation. So all in a sudden,
all in the case of corona, COVID infection.
Yeah, the festival of or the celebration of success turned into again a added vigilance. So this is a lesson to take from. The system should not be getting overconfident about doing something better at the initial stage. Now we need to be prepared more for the growing kind of a situation, the growing epidemic, and then making our systems at the state level, at the district level, and at the block level, and at the peripheries. How are we kind of setting up this in anticipation of the problem? Even though it is not coming, the preparedness is important. So that is where I think a major challenge is, waiting for India.
Clearly, the situation needs a lot of work, and let's hope that the governments, both state and center, they come together to rise to this challenge over and above any other politics that is taking place in this country. Keep watching NewsClick.